Okay, my name is Melissa Hinsman, and the title of my speech today is What is Duchenne Muscular Dystrophy? Now imagine your infant son not meeting important developmental milestones. Now imagine he is diagnosed with a disease called Duchenne Muscular Dystrophy. After this diagnosis, you would probably have lots of questions, like what are the symptoms, what caused this disease, and what treatments are available. I have lived with somebody with Duchenne muscular dystrophy as a sister and now as a mother, and I am here today to inform you of what Duchenne muscular dystrophy is and what some of the characteristics of the disease are. First, I want to introduce you to my son, Caleb. He's 12 years old, and he was diagnosed at 2 years old. And as you can see, he's a happy, healthy boy. He's excited for tomorrow, his summer camp. It's in Monticello, Iowa, Camp Courageous. And so I just want to start out with exactly what Duchenne muscular dystrophy is, or DMD as it's sometimes called. There's a website from Sarepta Therapeutics. It's called Duchenne.com, and it describes the disease it weakens the body's muscles over time. And once that muscle tissue is weak or gone, it cannot be fixed or replaced. And then I also found on the Muscular Dystrophy Association's website, mda.org, where you can find that the cause of the disease is a genetic mutation that interferes with the body's ability to make dystrophin, which is a protein that your body needs, that's necessary to produce and maintain healthy muscles. And DMD is not curable. And if you look on the mayoclinic.org website from the Mayo Foundation for Medical Education, they state that there are treatments available. There's a few medications like Emflaza, prednisone, and they'll also use enalapril, which is like a statin drug that helps to strengthen the heart, keep the heart muscle strong. There are surgical and other procedures as well. And we also do physical and occupational therapy. Caleb does stretches at night as well as wearing night splints on his feet to keep the feet nice and straight. So, which brings me to my next topic here. I'm going to talk about some of the information I also found on Duchenne.com on some of the characteristics. And there's also a movement I want to discuss that a lot of the kids living with DMD will use to adapt to their muscle weakness. Some of the characteristics are the enlarged calves. This is known as pseudo-hypertrophy. And they will also walk with like their belly protruding, or they'll walk with their toes pointed out. Obesity can also be a problem for kids with DMD, sometimes caused from certain medications like prednisone. Can also cause scoliosis as the muscles in the back begin to weaken. There's also challenges in brain functions such as attention, memory, speech, and intellectual ability. The school is really great about working with him. He's on an IEP, so they're starting to get to know that too. And as he transitions to 7th grade next year, he's pretty excited about that. So they're pretty good about working with us with that. And then I also want to talk about one of the movements, the maneuver called the Gowers maneuver that the boys with DMD will often do. I know a lot of you have seen Caleb, where he'll get up from the floor or get up from a sitting position. He'll use that Gowers maneuver, or Gowers sign, it's sometimes called. And it kind of involves like they'll walk up their legs in order to get into a standing position. That's the best way to describe it, I guess. This was first, I found this on Wikipedia too, it's kind of interesting. The movement was first described by a neurologist named Richard William Gowers, and that was way back in 1879, so this disease has been around for many years. So, now lastly, I wanted to give you a brief history of the disease as well. This is from, according to MDA.org, the Muscular Dystrophy Association's website. DMD was first described in the 1860s. And this was by a French neurologist named Guillaume Benjamin Armand Duchenne, and it was named after him. Little was known about the disease back then, and it wasn't until 126 years later, in 1986, that researchers identified the gene. It was on the X chromosome that when it is mutated, it leads to the DMD. The next year, in 1987, the researchers also identified the protein dystrophin that I mentioned earlier, that's associated with the gene that causes DMD. Okay, now finally, I just want to summarize some of the main points that we went through. First, we explained what DMD is and what causes it, what treatment options were available, I also discuss what the characteristics of DMD are and what some of the, one of the movements, the Gowers movement, that uses, that the kids will use to adapt to their muscle weakness. And I also explain the history of DMD. And the reason I wanted to talk to you all about it today, brought you all together here about Duchenne muscular dystrophy, is because, keeping people informed, I think, is the best way to ensure that families like ours that are living with DMD, they'll continue to receive the support they need to live like their best lives and to live as independently as possible. We don't know what the future will hold, but the new treatments that researchers are developing gives us a hope for a stronger future for us. So thank you all for coming today. So I really appreciate it.